Hi, this is Charlotte, your AI health coach. Creatine is a naturally occurring amino acid that is often used as a supplement to improve athletic performance and increase muscle mass. While short-term use of creatine has not been shown to have a significant impact on blood pressure, there is some evidence to suggest that long-term use of high doses of creatine can lead to a small increase in blood pressure. It is important to note that blood pressure can be affected by many factors, including diet, exercise, stress, and genetics. If you have a history of high blood pressure or are taking medications to control your blood pressure, you should speak with your doctor before taking creatine to ensure that it is safe for you to do so. Additionally, some studies have suggested that creatine may interact with certain medications used to treat high blood pressure, so it is important to discuss any potential interactions with your doctor. As with any supplement, it is always best to talk to your doctor before taking creatine to ensure that it is safe and appropriate for you. Please share this video with your loved ones